friends, I am Soham Bera, Senior Consultant Optometrist from India. Today I am going to tell you about Lasik. What is Lasik and how it done, and do you need Lasik? This video is all about Lasik. Let's start it. Refractive surgery is the term used to describe a surgical procedure that correct common vision problem, means nearsightedness, myopia, farsightedness, hypermetropia, astigmatism and presbyopia, to reduce your dependence on prescription eyeglasses and or contact lenses. Currently, a laser procedure called Lasik is the most popular refractive surgery performed in the whole world. But there are other type of refractive surgery, including other laser procedure and intraocular lens procedure, that might be even better choice for you depending on your needs. This video will help you learn more about your surgical option so you can better discuss them with your eye specialist if you are interested in elective vision corrective surgery. In Lasik, a thin flap in the cornea, the black portion of our eye, is created using either a microkeraton blade or a femtosecond laser. The surgeon pulls back the flap, then removes some corneal tissue underneath using a skimmer laser. The flap is then laid back in place, covering the area where the corneal tissue was removed. With nearsighted people, means myopic people, the goal of Lasik to flatten too steep cornea. With farsighted, means hypermetropic people, a steeper cornea is desired. Lasik can also correct astigmatism by smoothing an irregular cornea into a more normal shape. If you are considering Lasik eye surgery, your first step to choose a good Lasik eye surgeon who can evaluate whether Lasik is right for you. Your Lasik surgeon will examine your eye to determine their health, what kind of vision correction you needed, and how much laser ablation, corneal tissue removal is required. The eye specialist will also ask about your health condition that may disqualify you altogether for Lasik surgery. If you are not a candidate for Lasik, you may qualify for another laser surgery such as PRK, similar to Lasik but without the flap. Lasik or Lasik, there are also non-laser vision correction procedure. Your prescription and eye structure will be considered to help determine which procedure is best for you. Lasik is an outpatient procedure, so you don't have to stay at the surgery center overnight. The Lasik surgeon uses a computer to adjust the laser for your particular prescription. You will be asked to look at the target light for a short time while the laser sends pulses of light to painlessly reshape your cornea. The actual Lasik surgery usually takes less than 5 minutes. Lasik, which stands for laser in situ keratomydosis, is a popular surgery used to correct vision in people who are nearsighted, farsighted or have astigmatism. All laser vision correction surgeries work by reshaping the cornea, front surface of our eye, and the clear front part of our eye, so that light traveling through it is properly focused onto the retina located in back of the eye. Lasik is one of a number of different surgical techniques used to reshape the cornea. Now come to the point, what are the advantages of Lasik eye surgery? Lasik has many benefits, including it corrects vision. Around 96% of patients will have their desired vision after Lasik, and enhancement can further increase this number. Lasik is associated with very little pain due to the numbing drops that are used. Vision is corrected nearly immediately or by the day after Lasik. No bandage or stitches are required after Lasik. Adjustment can be made years after Lasik to further correction vision if vision changes while you age. After having LASIK, most patients have a dramatic reduction in eyeglasses or contact lens dependence, and many patients no longer need them at all. Now, what are the disadvantages of LASIK eye surgery? Despite the pulses, there are some disadvantages to LASIK eye surgery. LASIK is technically complex. Rare problem may occur when the doctor creates the flap which can permanently affect vision. This is one reason to choose a surgeon who is very experienced and performing this surgery. LASIK can rarely cause a loss of best. LASIK can rarely cause a loss of best vision. Your best vision is the highest degree of vision that you achieved while wearing your contacts or eyeglasses. What are the potential side effects of LASIK eye surgery? Some patients experience discomfort in the first 24 to 48 hours after LASIK eye surgery. Other side effects, although rare, may include glare, seeing halos around image, difficulty driving at night, fluctuating vision, and dry eyes. How should I prepare for LASIK eye surgery? Before LASIK eye surgery, we will meet with a coordinator or eye surgeon who will discuss what to expect during and after the procedure. During this session, your medical history will be evaluated and your eyes will be fully examined. Likely initial tests include measuring corneal thickness, refraction, corneal mapping, air pressure, and pupil dilation. Once you have gone through the initial evaluation, you will meet the surgeon who will answer any question you may have. Afterwards, you can schedule an appointment for this procedure. If you wear rigid gas permeable contact lens, you should not wear them for at least 3 weeks before your evaluation. Other type of contact lens shouldn't be worn for at least 3 days prior to evaluation. Be sure to bring your eyeglasses to the eye specialist so your prescription can be reviewed. On the day of your surgery, eat a light meal before going to the eye specialist and take all your prescribed medication. Do not wear eye makeup or have any bulky accessories in your hair that will interfere with position your head under the laser. If you are not feeling well that morning, call the eye specialist office to determine whether the procedure needs to be postponed. What happens during LASIK eye surgery? During LASIK eye surgery, an instrument called microkeratome or femtosecond laser is used to create a thin flap in the cornea. The corneal flap is then painlessly peeled back and the underlying corneal tissue is reshaped using another laser. After the cornea is reshaped so that it can properly focus light into the cornea, the corneal flap is put back in place and the surgery is complete. LASIK is performed while the patient under local anesthesia in the form of eye drops and usually takes about 10 minutes to complete. Patients may also request mild sedation. Plan to have someone drive you home after surgery. What should I expect after LASIK eye surgery? Your eyes will temporarily be dry even though they do not feel that way. Your eye specialist will give you prescription eye drops to prevent infection and inflammation and eye drops to keep your eyes moist. These drops may cause momentary sight burn or blurring of your vision while you use them. Do not use any eye drops not approved by your eye specialist. Healing after LASIK eye surgery usually occurs very rapidly. Vision may be blurred and hazy for the first day, but most patients noticed improved vision within a few days of surgery. Specific follow-up after the surgery varies from one surgeon to another. You will revisit the doctor for an evaluation 24 to 48 hours after LASIK eye surgery, as well as at regular interval within first 6 months.